Hello everyone, this is Dr. Saurabh Sahi and welcome back to my channel, Doctor's Storyboard. So let's start our DHA Gp notes, the extracted version of Master the Board. Continue with lesson 3. Hepatopulmonary syndrome, there is no treatment. Acute alcoholic hepatitis, 50% of mortality. Biochemistry. In case of alcoholic hepatitis, AST is greater than ALT. Elevated GGTP and bilirubin can be seen. Also, we can see elevated level of INR and prothrombin time can be seen. Discriminant factor are as follows: 4.6 multiply patient platelet minus control platelet plus bilirubin. And when the discriminant factor is greater than 32, we have to treat the patient with steroids. Unlike alcoholic hepatitis, where AST is greater than ALT, in case of viral hepatitis, ALT is greater than AST. So this is vice versa, opposite. Please remember, this might be coming in DHA exam and other competitive exam as well. Now comes primary biliary cholangitis. Primary biliary cholangitis happens to mostly with the woman who is above 40 years of age or 50 years of age. The typical features are fatigue and itching, and in this disease the bilirubin is normal. Please remember, bilirubin is normal but alkaline phosphatase is increased. Please see the biomarkers, biochemistry markers of the disease very carefully, because they are the indicator, and it is very important to know the biological marker, biochemistry marker, because they will be confusing the scenario of the questions. So most unique feature of PBC are xanthelasma, xanthoma, osteoporosis, accurate test, liver biopsy, accurate blood test, antimicrobial antibody. The treatment is ursodeoxycholic acid or obeticholic acid. Normally in market, ursodeoxycholic acid is available in 300 mg. Hemochromatosis. Hemochromatosis is overabsorption of iron in the duodenum, and the presenting features of hemochromatosis are fatigue, joint pain, erectile dysfunction in men, amenorrhea in women, skin darkening, diabetes and cardiomyopathy. Another points about different things about hemochromatosis. Vibrio vulnificus, Yersinia and Listeria infection occurs in hemochromatosis, and the diagnostic tests are increased serum iron and ferritin, decreased iron binding capacity. Treatment of hemochromatosis is phlebotomy. Other treatment include iron chelation therapy, and chelation is done through despheroxamine. PCR, polymerase chain reaction for viral replication activity. You know, these days COVID-19 is going on, so you know what is PCR. So PCR is done in viral replication activity. And biopsy is to detect the bulging necrosis. PCR RNA viral load is the most accurate way of determining the disease in case of hepatitis. Liver biopsy determines the degree of inflammation and fibrosis. Treatment of chronic hepatitis B with one of the following, that is adifovir, lamivudine, telvivudine, entecavir, tenofovir, interferon. To know and understand about these drugs, you need to see the classification of pharmacological drugs, antiviral drugs. Then you will be having more idea about the antiviral drug. But at the moment, these are the antiviral drugs used for the treatment of hepatitis B. So what predicts the response to hepatitis therapy? Genotype. PCR RNA viral load tells if there is response. Adverse effect of hepatitis medications. Interferon. When someone is using the interferon, just remember they will have arthralgia, thrombocytopenia, depression and leukopenia. And in case of ribavirin, anemia is noted. Please remember, ribavirin, anemia, this will come in exam. Adifovir, this will cause renal dysfunction, the adverse effect. Lamivudine, normally the side effects are not noted. Another point, abnormally decreased copper excretion from the body is Wilson's disease. In another word, accumulated in liver, kidney, RBC and nervous system. I mean, this copper is deposited in liver, kidney, red blood cell and nervous system. This is the disease where you can see Kayser-Fischer ring in the eye. Coombs negative hemolytic anemia is also seen in Wilson's disease. So, you need to know Coombs negative test, Coombs positive test, Coombs negative hemolytic anemia. If you make the list and study, the point will not be missed out and it will be very easy in exam. Slit lab examination is done in Wilson's disease for Kayser-Fischer ring. Copper is deposited in Descemet's membrane present in eye. So treatment of Wilson's disease, penicillamine, zinc and trienterine. The drug of choice for Wilson's disease is penicillamine. Please remember. Test for autoimmune hepatitis. Immunoglobulin G and antibodies and anti-liver / kidney microsomal antibodies. Most accurate test is liver biopsy. And in case of autoimmune hepatitis, treatment is done with prednisolone and azathioprine. So, try to study little bit detail about autoimmune hepatitis because this is also one of the question coming in the exam. When you see the question and answers of other friends who are launching the question and answers in YouTube, try to note this question very importantly. Non-alcoholic fatty liver disease is associated with obesity, diabetes, hyperlipidemia and corticosteroid use. So, modes for end stage liver failure disease score or MELD score. In end stage liver failure disease, we see is creatinine and need for dialysis and bilirubin and INR. Central stellate scarring is found in focal nodular hyperplasia which requires no treatment. Patient with hemangioma present with right upper quadrant brain and lesion is less than 5 cm and there is no treatment. Hepatic adenoma changes with hormone level and grows with estrogen. Pituitary incidentaloma management. Less than 1 cm tumor, MRI has to be done yearly and prolactin level has to be checked. If the lesion is greater than 1 cm, MRI has to do done yearly, prolactin level and other markers that we need to check are 24-hour cortisol level, T4, TSH, LH, FSH, IGF, visual field test, and these are done visual field test for evidence of optic chiasm compression. Empty cella syndrome is associated with surgery, obesity and radiation therapy. Panhypopituitarism is caused by any condition that compresses or damages the pituitary gland. Metastatic cancers, adenoma, Rach's cleft shift, meningiomas, craniopharyngiomas or lymphoma can compress pituitary gland. Also, hemochromatosis, sarcoidosis, histiocytosis or fungal infection can damage the function of pituitary gland. So, effect of decreased LH and decreased FSH in both women and men. In case of women, when there is decreased LH or decreased FSH, there is no ovulation, there is no menstruation. In case of men, there is no sperm production or testosterone production. There is erectile dysfunction and there is decreased muscular mass. Both will have decreased libido, decreased axillary pubic hair and body hair. Renal agenesis is 50% in Kallmann syndrome. Please study detail about Kallmann syndrome in other books. KAL1 mutation is seen in Kallmann syndrome. So Kallmann syndrome, mnemonics is KAL1. Kallmann, KAL1. Kallmann, KAL1. Please remember. This is the end of today's lecture. I hope you like it. And if you are the first time viewer of my channel, please like, share and subscribe and wait till another videos.